are so much farther ahead than we would ever be if we didn't have nursing care. He would have been hospitalized so many more times. He already gets RSV and pneumonia several times a year as it is. But if I didn't have a nurse out here to help and do the CPT and do the breathing treatments, there's no way that I would be able to keep up.
Ashley Zeno, she's a mother and a nurse in Mustang, and she's worried about how our rule change from the Oklahoma Healthcare Authority will affect her family. Zeno adopted Joey, a 3-year-old boy with Cru-de-Shaw syndrome, from the Oklahoma Department of Human Services. Joey cannot walk or talk and communicates through different cries and some sign language.
He understands quite a bit of what we say, and it's very frustrating for him because since he understands everything but can't communicate it back, that's where we get the self-abusive behaviors with the head banging, and he's missing his front tooth from banging his face on hard objects. If he can't find a hard object, like right now he's trying to bang his head on this, he can't reach it because of the strap. But let's say he's sitting on the couch and he's mad, he's not going to bang his head on the couch, he'll get down to the floor and then bang his head on the floor on purpose.
He needs daily care from a nurse, and currently Zeno serves as one of his nurses. The nursing care that Zeno provides is paid for through Oklahoma's Medicaid system. The Oklahoma Healthcare Authority, which manages Medicaid, might vote Thursday to no longer allow relatives of the child to serve as nurses and be reimbursed for that care.
I was his foster parent, but I was also his nurse for part of his shifts. Doing that allowed me to be able to stay home and take care of him because, again, he can't go to a daycare. So I can't work outside of the home with having him in my home. I'm stuck. So by being allowed to work as his nurse for part of the shifts, it meets the family income.
Now, if the Healthcare Authority changes its rule, Zeno would no longer be a paid nurse of Joey's and would have to seek a job outside of her home. Zeno says there aren't enough nurses as it is, and she will have trouble finding a job that will understand her hectic schedule.
If I had a job, what am I supposed to do? Call the hospital and say, hey, I'm sorry, I'm going to be late. I don't know when I'm going to get there. If that doesn't work, another nurse in the hospital would have to cover my shift and stay however late until I showed up. Nurses aren't going to stand for that. They do their shift, they want to go home when they're done. And he qualifies for nursing 12 hours a day, 7 days a week. So what that means is he should potentially have 2 full-time nurses, each of them working 3.5 days a week. And if the system was working perfectly, that's what would happen. He would have 2 full-time nurses. They would be trained in the beginning, they would know what to do, and they could just run with it. And then with that in mind, then I could easily go work outside of the home. It doesn't work that way.